and protective factors of using drugs. The use, misuse, and abuse of drugs are the result of various factors surrounding a person. These factors either increase or decrease the possibility of a person to use drugs. Risk factors are those influences which increase the chances of using, misusing, and abusing drugs. Protective factors, on the other hand, are those influences which decrease the chance of using, misusing, and abusing drugs. Risk and protective factors affect people in 5 domains or settings. 1. Personal. Early aggressive behavior versus self-control. Risk and protective factors affect people in 5 domains or settings. 1. Personal. Early aggressive behavior versus self-control. As a person grows, there are risk factors that can influence or affect that person's drug taking. Here are some examples. Use of drugs at an early age, risk-taking behavior, childhood problems, feelings of isolation. There are also protective factors that can decrease the chances of drug taking. Here are some examples. Self-control behavior, good reasoning skills, positive interaction with people, sense of belonging.
Number 2. Family. Weak parental guidance versus strong parental guidance. The examples of protective factors are good communication, positive family relation, clear and consistent family rules, and strong family values. The risk factors are disinteraction with each other, poor family values and ties, history and patterns of drug use. Number 3. Peers and friends. Substance abuse versus academic excellence. Examples of risk factors are preference to stay with peers and friends than family. 2. Association with peers and friends known to use getaway drugs like cigarettes and alcohol. The examples of protective factors are 1. Promotion of friendships, 2. Reliance on friends for emotional support, and 3. Inviting friends at home to know the family. Number 4. Schools. Availability of drugs versus strong anti-drug policies. The risk factors are poor academic performance, lack of commitment to studies, and involvement in fights and conflicts. The protective factors are good to excellent academic performance, joins extracurricular activities and school organization, and show interest in attending classes.
Five. Community. Poverty versus strong community relationship. In our community, there are also risk factors that can influence or drug abuse. For example, easy access to gateway drugs, poor community organization and neighborhood relationship, poor implementation of community laws. But there are also protective factors that can reduce the chance of drug taking. For example, strong community relationship, active and positive community programs, strong community advocacy against drug use. 5. Community.